Alright, nerdies, what we have, okay, we have got anemia, okay? It should be above 12, alright? And then we see it is a macrocytic anemia. We know that the macrocytic anemia, we have the two causes mostly, alright? And then, alright, this is also a bit decreased. This is not hepatocytosis. Okay, well, let's see what else we have. We have to differentiate between these. Which one is that based upon the sign and symptom of this? Ankle reflexes greased, okay, and oh, of course, this will show the pale conjunctiva, okay, shiny tongue, one thing, two thing, and then we have patients a balanced diet, okay, there is like no dietary, we have fatigue, so diet, we are going to assume, we have to see hemoglobin decrease, we have to see MDD, we have to see some thyroid disorder, we have to see some carcinoma, and blah blah blah, and then we have like the tingling sensation, okay, and that's it. So we are going to, of course, take this one. So what could be the cause of this one? Of course, this. So we know how it goes. We have like salivary R, the things which are on the saliva, and then we have like the folic acid which combined with the animal proteins. It goes in there and then it gets separated from this and it combined with this. And in this part, we have the parietal stuff which increase HCl, which is intrinsic factor. So this whole goes to this, then R gets separated, pancreatic enzyme come, intrinsic factors also get separated. And then we have like the B12. If the B12 is deficient because of the any reason, let's say because of the carcinoma, because of age, because of the fatigue, because of, so what are the sign and symptom? First, you have got the breeze reflexes as told by the question. You have this shiny smooth tongue. It's also told the question. You have the MCV would be greater than 100. You have the anemia. And you have, what else we have? We have the tingling sensations. We have the paresthesias. And we might also have the esophagus pain. We might have the occult bleeding. So these are the signs. And we need to see a endoscopy. In any of these symptoms, any of this, we need to go for the endoscopy to see this because of the chronic autoimmune disorder, which is going to destroy the intrinsic factor, will lead to the intestinal metaplasia, which will ultimately lead to the cancer. So you really have to rule that out. Okay, the next thing is these differentials. So in T-cell lymphoma, we have the weakness plus upper motor neuron symptoms like the Binkase and clonal and spasticity. In glomerulonephritis, SLE could give the glomerulonephritis as well as it could give the paresthesia. We also have take this in cirrhosis. We also have the paresthesia because of the Hep C, because of the thrombocytopenia. We also have paresthesia. In aortic aneurysm, we have the paresthesia if it is because of the syphilis, like the neurosyphilis, like the tabes dorsalis, which can damage the tract. In AML, which could be the myelofibrosis, which might lead to some of the symptoms. So, yeah, we have diagram. The first thing is, from the saliva, your R comes are going to combine with the B12. But before that, animal 14 and A, these are to be combined. Then because of the acidity this gets, they won't get along, so they two will combine. And then the lateral part, these will be separated because of the pancreatic secretion and it will combine with the IF and it will travel to the third part and then it will be separated and then B12 in this area gets absorbed. So any abnormality with all of these could also lead to the B12 deficiency as well. But this looks more like a carcinoma, for example, the age and rest of the symptoms.